Hello, I am Dr. Susanna Park. I am a professor of ophthalmology at University of California, Davis Eye Center. I'm also the Barbara A. Allen M. Roth MD Endowed Chair in the department. I also direct the Retina Service and the Vitreoretinal Fellowship in our department.
Please tell us about your presentation on the status of stem cell therapy.
So it was very fortunate that I was invited to participate in the Retina Subspecialty Day for 2022 in the Gene Therapy Stem Cell Therapy subsession. And my topic was stem cell therapy for retinal diseases. Where are we now? So my presentation, the goal of my presentation was to update the retina specialists in the audience on progress we've made in clinical trials using stem cells, and to remind patients and clinicians that this is still an investigational treatment and it should be only administered in the setting of a clinical trial and not fee-for-service. So I think the advantage of stem cell therapy, and the reason why people get excited about the idea of using stem cell therapy, is that it is a mechanism for retinal regeneration. So you can use cell therapy for retinal replacement or retinal rescue when you have a disease process that damages the retina and results in vision loss. And with stem cell therapy, we've shown convincingly in animal models that you can improve retinal function and you can improve the health of the retina. So translating that information to patient care involves very carefully designed clinical trials, because stem cell therapy treatment has some challenges. First of all, you need to make sure that the cell product you administer to the patient is sterile and of purity. You don't want to have contaminating cells that might have side effects. You don't want to have bacteria or something that's going to cause an infection. And so these cells need to be carefully characterized at the end of the harvesting to make sure it's good enough for administration to patients. And it involves the use of a special laboratory called Good Manufacturing, or GMP laboratory, which is a specially built laboratory for this purpose, for clinical applications of stem cells. And it's a special extra sterile environment where people are all hooded and so that they don't contaminate the cell product. It involves licensing, and these centers are only available in a few areas in the country. So the other concerns about using stem cell therapy is if you use somebody else's stem cells, then your body is going to reject the cells, and the cells are going to die and not work. So there is some debate as to how much immunosuppression you have to administer to patients when you're using somebody else's stem cells. And sometimes you use systemic immunosuppression that involves the whole body. There are some people who feel you don't need to use immunosuppression. So it's an area of ongoing research and study. But last but not least, the most important challenges we've had is in clinical trials. Some of the clinical trials had to close early because when they injected their target stem cells, they started to grow abnormal tissue in the eye and cause further damage to the retina. And so this is an important safety concern, probably unique to stem cell therapy, that all clinical trials should be wary of and proceed carefully to ensure that we don't make the retina worse with any of our treatments.
What are the different methods to applying stem cell therapy?
So I think there's pros and cons of different stem cells that have been explored, and I think it's a good idea that we explore this area of research from multiple angles, because only time will tell which is the best approach. So far we have several promising clinical trials that are ongoing and enrolling that are using pluripotent stem cells as well as multipotent stem cells. So pluripotent stem cells are what people consider stem cells. These cells can develop into any tissue in your body. So they have theoretically indefinite opportunity to replace damaged tissue. And they include embryonic stem cells and induced pluripotent stem cells. And induced pluripotent stem cells manufactured stem cells from your own cells. So you can take any cell in your body and chemically alter them to behave like embryonic stem cells. So those two approaches have been used, but you cannot take pluripotent stem cells and inject them directly into the eye because they will develop a tumor in the eye. They'll keep growing. And so we do not do that. So people have used these pluripotent stem cells and made them into retinal pigment epithelial cells. And these are retinal cells that were supporting cells underneath the retina that's important for retinal health. And these cells have been injected under the retina in eyes with macular degeneration, because one of the main tissue that's damaged in macular degeneration is the retinal pigment epithelial cell. So by making these differentiated retinal pigment epithelial cells and injecting them subretinal into the area of damage, the goal is to replace the damaged retinal pigment epithelium and hopefully to improve vision. The other approach is to take multipotent stem cells. So multipotent stem cells are partially differentiated stem cells. So they can become different cells in the body as well, but the number of types of cells they can become are a little more limited. And examples of multipotent stem cells are retinal progenitor cells that you can get from fetal tissue. Our group looks at CD34 bone marrow stem cells that you can get from your own bone marrow. And these cells can be injected just into the eye in the clinic and not with surgery, because they secrete factors that promote tissue repair and regeneration. So those are the two approaches people have used to apply stem cell therapy to patients with retinal problems.
With the different methods to distribute the stem cells, is there one method that seems to work better than another?
Well, that's a really good question. It's easier to just inject cells in a solution, and that's been tried in a couple of early phase clinical trials in eyes with dry macular degeneration and Stargardt's disease. And the treatment was well tolerated, and the first study got lots of excitement because the mean vision improved in the patients. But they repeated the study in UK, United Kingdom, and they didn't see the improvement. And so the cell therapy was similarly tolerated, but they didn't see the improvement. So that's where we are with the cell suspension or solutions of stem cells. So the idea was that if you take retinal pigment epithelial cells and just inject them in a solution, they are not oriented in the right direction. So people have started to grow them in a scaffold or some sort of framework so that you can orient the cells in the right way when they're placed subretinal. So, if you take a mat or some sort of scaffold that has the cells growing, the advantage is that you have the cells in the right orientation. The disadvantage is that it's probably a bigger surgical trauma because you have to make a larger opening to put the mat under the macula to have it in the right position. Nonetheless, there is a phase 1/2 clinical trial that's going on in Southern California using a implant with the retinal pigment epithelial cells from embryonic cells that's grown on a mesh, as you call it, and injected through surgery under the retina. And they've showed that recently that at 1 year follow-up, you don't have abnormal cells growing in the eye, you don't have horrible things happen, so it is relatively well tolerated. They did have some side effects like bleeding from the trauma of the surgery. Nonetheless, the optimistic thing is that 27% of eyes seem to improve vision of 1 or 2 lines. It's not a huge amount, but there was some improvement in some of the patients, and these are patients with pretty advanced macular degeneration. So the study is not designed to show efficacy, but the fact that some patients had improvement in vision is always an optimistic sign. I just wanted to mention that there are other approaches people have used for stem cell therapy, and the multipotent stem cells have been used, and they've been injected directly into the eye without surgery, and they've used retinal progenitor cells from fetal tissue. And our group has looked at CD34 stem cells in our bone marrow, which are natural repair cells in our body. And these cells can be used for damage of any retinal tissue, so it's not disease specific, so it can be used for macular degeneration, diabetes, and so on. And we've shown in a phase 1 clinical trial that it's very feasible and safe to get stem cells from your bone marrow that are repair cells and inject them to the eye. And some of the patients actually had improvement in vision. So, currently we are doing larger clinical trials exploring this cell therapy in eyes with vision loss from central retinal vein occlusion, as well as retinitis pigmentosa. So,
how can patients find a legitimate stem cell clinical trial? And what are some of the red flags people should be on the lookout for?
So regarding, finding clinical trials, especially if you're interested in stem cell therapy for retinal disease, you should go on clinicaltrials.gov and type in the word stem cells and whatever your retinal condition is, and they will give you a list of clinical trials that have been completed or enrolling, and you can get an idea of what studies are being done. I do have to mention that just because it's listed in clinicaltrials.gov, it does not mean that it's a well-designed and regulated clinical trial. So there are some unregulated rogue clinical trial treatment centers that are popping up all over the country, and I've had patients come to me asking about them because they come to their living facility and give presentations and offer great hope for patients with vision loss, example for macular degeneration. And you have to be really careful because these quote stem cell centers are injecting cells and we don't know what they are because they haven't been purified or characterized, and they charge a huge amount of money. It's a fee for service, and those two factors should kind of warn you that you shouldn't participate. So clinical trials that are legit, that are for research, they do not charge a fee for service. So all the treatment fees are covered by a grant. And so if they're asking you to pay money to participate in a clinical trial, you should be wary that it's not a legit clinical trial. And the reason you need to be wary of these centers is because some people have lost their remaining vision from participating in these unregulated and clinical centers that offer treatments. So yeah, just you can find the on clinicaltrial.gov's centers, but I would do additional research, call the investigator, get more information about the study, what's involved, and if they start asking you to pay money, that's probably a warning sign that you shouldn't participate.
How can patients get involved with one of your stem cell trials?
So you can contact me directly via email. My email is sscpark@ucdavis.edu. Our clinical trials are also registered in clinicaltrials.gov, and if you go online on that website, they give you the contact information for all the investigators with different clinical trials. So for our clinical trial, currently we're enrolling patients with vision loss from central retinal vein occlusion, and we're injecting your own stem cells from bone marrow directly into the eye. If you're interested in learning about the study or participating, please contact me or my study coordinator, and you can get that information on clinicaltrials.gov. If you also have vision loss from retinitis pigmentosa in both eyes, we are doing a smaller study for that. We're in the final phase of enrollment. So please also contact our office and we can give you more information as to whether you qualify and whether you may be interested in participating.